Hello, back again. Dr. Coring here with another episode of Real Health Talk with Dr. Coring. For those who do not know me, again, my name is Dr. Coring. I am an internist by training and trade, and also currently learning how to be a hematologist oncologist in fellowship training. And it is my passion to advocate as well as educate health education, specifically for common folks such as yourself. I really enjoy educating patients in order to essentially build health literacy. I strongly feel like healthy patients are educated patients, and or educated patients are healthy patients. And so therefore, I strongly believe that in educating our patients, we can have better health outcomes. That being said, I would like to spend this time in this episode discussing prostate cancer. However, I would like to mainly focus on prostate cancer in the African American community. Obviously, African American men, because prostate cancer only affects men. And therefore, I would like to talk about prostate cancer screening. Why is this important? Well, it turns out that African American men are at an increased risk of developing prostate cancer more than any other race. And therefore, African American men die from prostate cancer sooner, a lot quicker than any other race. That being said, it is recommended that African American men get screened for prostate cancer at an earlier age versus any other race. And so, therefore, I would like to discuss three main points around this topic. But before I get started in talking about the topic of the day, let's just talk about quickly what is prostate cancer. And so, prostate cancer is a cancer that obviously develops in the prostate gland, which is a gland essentially distal or right below the bladder. And the prostate gland is instrumental in allowing us to have the ejaculation fluid. And so it's instrumental in, manufacturing semen as a vehicle for the ejaculate and also as a vehicle for sperm. And so that's the main function of this gland. And this gland can get enlarged and cause benign prostate hypertrophy, which BPH can cause symptoms of urinary incontinence. And also, this gland can be affected by cancer, a malignancy that can eventually develop and also spread or metastasize mainly to the bone that we see a lot, which lead to fractures and ultimately people with prostate cancer essentially pass away because of complications, urinary complications, which essentially leads to infection. And we do know, based on research and also based on clinical evidence, that African American men or people or men of African descent suffer from this disease more so than any other population. So what are the risk factors? Well, it turns out that this disease manifests at a later age, midlife, I would say, more so at around the age of 50. However, we are realizing that African American men are affected at an earlier age, hence why it's now recommended that we screen at an earlier age. So older age is a risk factor. Race, we talked about being of African descent is a risk factor. Family history of prostate and breast cancer is also a risk factor. Obesity is a risk factor. So here are the modifiable risk factors. Obesity is something that we relatively can control. So that could be modified. And so obviously losing weight can reduce the risk factors. Tobacco smoke is another risk factor that could be modified. So stopping smoking can also help. Other risk factors, diet, not participating in a plant-based diet. So diet with meat products can be considered a risk factor. And so obviously, controlling our diet and eating more plant-based products can help mitigate that risk factor. And so let's talk about three main points that I would like to discuss regarding, African Americans being at higher risk of prostate cancer. And I really want to basically own in on the fact that when I say we, because I am an African American male myself, we need to basically get screened at an earlier age. In fact, to this point, there was basically a nice article published in the New England Journal of Medicine, April 2024, so this year, by the Prostate Cancer Foundation, basically suggesting that African American men should be screened starting at the age 40, so between 40 and 45 years of age, especially if you have these non-modifiable risk factors, such as family history. So if you're African American men between age 40 and 45, especially with a family history of prostate and or breast cancer, you should probably get screened at age 40. If you don't have the family history risk factor, I would still suggest that you should probably get screened at the age of 40, no later than 45, for sure. All right. So the three things I would like to discuss for the remainder of this session or this episode is one point I would like to discuss is that African American men, we get prostate cancer sooner than any other race, and we die sooner. And so we get the disease quicker and we die quicker. And so that means ultimately we have poorer outcomes. And so that fact right there is driving the decision to get screened at an earlier age. All right. And so why does this happen? Why do we get this disease sooner and die quicker? The fact of the matter is we don't have a good understanding or a good explanation. Right now the science is saying that it's a multitude of reasons. Maybe it's a socioeconomic reason. So basically what is that? That's a fancy way of saying that maybe because Black people are more so poor, and then also the conditions around being poor, like what are the conditions around being poor? Well, you're poor, so you live in a poor environment, a polluted environment. You're poor, so you don't have access to quality fresh foods. All right. You're poor, you have access to fast foods. Remember, I talked about nutrition being a risk factor of prostate cancer. And so you're poor, you are exposed to cigarette smoke, secondhand smoke. All right. You're poor, maybe you're not exercising much because you don't have the luxury to do that because you're working so much. And so these are things that come into play when you're talking about the socioeconomic aspect of this cancer risk. So that's that. All right. Access to care. You're poor. Maybe you don't have access to good quality health care. So maybe, you've been diagnosed, but because, you live far away from a comprehensive cancer center or even a standard doctor's office or a standard healthcare facility, maybe that's affecting your treatment after your diagnosis. And so maybe that's affecting the poor outcomes. All right. Maybe the cancer itself, when a Black person gets the cancer, a Black man gets the cancer, maybe that cancer biology. So maybe the behavior of the cancer is more aggressive. All right. So these are all the postulations. These are all the hypotheses of why, Black men have a tougher time when we get diagnosed. But we do know that if we catch the disease or grab a hold of the disease or diagnose the disease at an earlier age or at an earlier stage, I should say, at an earlier stage, then there's hope. There's hope for cure. All right. There's hope for better outcomes. And so that's why the screening is important, because initially the prostate cancer could be asymptomatic. You may not have any symptoms. You may not have problems with your urination. You may not have any back pain. You may not have blood in the urine. These are common symptoms. All right. And so that's why screening is important, because you can live with prostate cancer for years before you even know it, before you even have any symptoms that's manifesting. Okay. The next point I want to talk about is the screening itself, what it consists of and why, the age have been moved. And it's obvious reasons why we're recommending screening Black people at an early age because, like I said, we have worse outcomes. All right, and so that's why the needle have been moved for us per se. And also, when the initial guidelines were recommended, this initial screening age, there were a lot of Black people represented in that group. All right, more so Europeans, and so the popular screening guidelines that are out now is basically recommendations that have been based on a population that's not well represented by African Americans. Okay. And so that guideline is not really reliable. And so there are new suggestions that have been recently published by the Prostate Cancer Foundation that suggest, hey, we actually have taken a closer look at this, and African American men, suffer and get diagnosed sooner. All right. And so we should probably screen, these people a lot earlier. And so that's that piece. The next and last piece I want to talk about regarding this topic is clinical trials, novel therapies. Okay. So the way clinical trials work, and there are two reasons why clinical trials are beneficial. One, clinical trials is a treatment modality, meaning the next step in some treatments is clinical trials. So there's benefit as far as treatment benefit. And then the next thing is we learn from clinical trials, meaning there's an educational piece for the greater good, for the scientific community as well as patients, okay? And so there are clinical trials where we just want to learn, meaning physicians, scientists, we just want to learn how this prostate cancer, or any cancer for that matter, is behaving. The reason why we want to learn is for treatment, prognosis, clinical progression. And so clinical trials are important from that aspect as well. The way it stands now, only 6.7% of African American men are represented in the clinical trial community for prostate cancer. Yeah, 6.7%. However, 70% of Black men in their lifetime will get diagnosed with prostate cancer as it stands now. So what I'm saying is 70% of Black men is going to get this disease. However, only 6.7% of Black men is represented by this disease in clinical trials. That don't make sense. All right? So what can we do? Well, we need to get in these clinical trials. Why? Because it benefits us. From a treatment standpoint, yeah, your prostate cancer can have treatment benefit with these clinical trials. There could be a clinical trial right now going on right now for your prostate cancer that could offer you benefit. Okay, so that's that. And also, we need to learn more about why this disease is affecting us more so than any other race. And the best way to learn about this is through a clinical study. Even if we take your blood, even if we take a sample of the prostate, just to see how treatment could be different. Prognosis could be different. Clinical progression could be different. So we need to learn that. So why is it only 6.7%? Well, I think there's a huge educational or miseducational or lack of educational component. All right. So I think there's a component of awareness, meaning we just didn't know. Black people just don't know there's a clinical trial for them. All right. And also providers, even oncologists don't know there's a clinical trial. And so we need to do a better job educating ourselves about this, being our own advocates. So we could go to our providers and say, hey, there's a clinical trial for my disease in my community. Can I be involved? All right. So how can we educate ourselves? Well, the Prostate Health Educational Network, PHEN, PHEN. You could Google that. They have clinical trial webinars that you could just educate yourself. Sign up, register for these webinars, and you can learn about clinical trials that are right now, enrolling patients right now that may have your biology, meaning your specific prostate cancer profile that you may qualify for. Okay? And so that's really all I really wanted to talk about, regarding this topic. So the things I really want you guys to take away from this is that black men are at a higher risk of getting prostate cancer and dying from it than any other race. All right. And because of this, black men and their doctors, you know, including myself, want you to consider getting screened for prostate cancer at the recommended age for us, which is 40 to 45 years of age. All right. So that's an earlier age of recommending. Screening. How do we screen? Just a blood test. That's it. Just get the PSA tested. And how do we do that? We just draw your blood, okay? And then the last thing, black men could benefit from joining clinical trials and other research studies related to prostate cancer. So what I'm suggesting is we should get involved with clinical research around prostate cancer. Why? Because we get benefit from it, and also meaning personal benefits, and you could benefit the greater good, the greater community, your brother, your son even. All right? All right? So it's a 70% chance as a black man you're going to get prostate cancer in your lifetime. All right? So that being said, get screened for it, because the sooner we find out, the better the outcome it can be for you. All right? So the sooner we diagnose it at an earlier stage, the better. All right? We can cure this disease if we catch it early. That's why screening is important. Peace and love, guys. I love you guys. Bye.